This film will show adults and carers how to get support. You can get support from a variety of places, including voluntary organisations and the council. Nottinghamshire County Council is working with organisations like the Alzheimer's Society to make sure that people are helped to remain as independent as possible for as long as possible. People will only be referred to the council when necessary, and they will be helped to complete an assessment of their needs using a variety of different methods.
The Dementia Cafe in Mansfield has just grown and grown. It's fantastic that people can come, they can bring their loved ones with them. Today we've done a night at the proms. I think we've also done a cartoon quiz, so it's just something to provoke memories, have a bit of fun. We do give expert advice to carers. We can refer on to the Department of Work and Pensions, to county councils, to social services for a carers assessment or a needs assessment for the person with dementia. We also involve the community where we'll get speakers come in, like the fire service, that would give safety checks out to people. We can refer into the fire service and they will go out and do a safety check on somebody's home as well.
I have a mother with dementia. We first of all thought she'd got Alzheimer's, but we've since learned that it's called mixed dementia. The Alzheimer's Society has helped me tremendously. I came across Angela at another carers meeting, set of carers meetings I go to do with Carers Federation, and she did a talk for us, and some of the stuff that she came out with was really helpful. I made an appointment to see Angela, and she was my lifesaver really, because it makes you realise that you're not by yourself.
We've heard from a member of staff and a carer about the support offered by the Alzheimer's Society. We're now going to talk to Jane North, Transformation Programme Director for Adult Social Care at Nottinghamshire County Council.
People like Anne's mother can expect to have good advice and information around the range of services that are available to them. This might be a signpost to the Dementia Cafe where we are today, or it could be for minor equipment or adaptations. People can find this information on our online directory called Nots Help Yourself, or alternatively they can phone our customer service centre. We're also looking to always try and maximise people's independence, and so we'd look to see whether our reablement services would be suitable for them. This is a service that helps people get back on their feet. We have a new carers hub that provides advice, support and training, and provides services such as the emergency carers card. Carers can expect an assessment to look at what their needs are and their circumstances, and if they're eligible, a personal budget allocation. This is a one-off payment to support them as a carer. For carers who are supporting loved ones at the end of their lives, we have specialist services to support them. And for carers who are close to breaking point, we have crisis prevention services.
The first carers assessment was done face-to-face. The second carers assessment was done a little bit later by her then social worker, who saw the plight that both my mum was in and my care, because she could see that I was at the end of my tether. And she said, what you need is a carers assessment for just something to boost your well-being. Yes, I would consider doing it online.
A carer's needs meet the eligibility criteria if the needs arise as a consequence of providing necessary care for an adult. As a consequence of the following, there is, or is likely to be, a significant impact on the carer's well-being. They are unable to achieve any of these outcomes. Outcomes are unobtainable if the carer's physical or mental health is or is at risk of deteriorating. Carrying out any caring responsibilities the carer has for a child. Providing care to other persons for whom the carer provides care. Maintaining a habitable home environment in the carer's home, whether or not this is also the home of the adult needing care. Managing and maintaining nutrition, developing and maintaining family or other personal relationships, engaging in work, training, education or volunteering, making use of necessary facilities or services in the local community, including recreational facilities or services, and engaging in them.
The assessment starts off by looking at somebody's strengths, looking at how we can regain their independence. It looks to what resources they may have in terms of family, friends or the community. And it also looks about what people are struggling with, what they're finding difficult, and particularly would look at things like daily living tasks and practical tasks and how they're being managed. We would think about what impact this is having on their lives in terms of the difficulties they're having, whether it's impacting on their health, their quality of life or well-being. If there's a carer involved, then also we'll be looking at the implications for the carer in terms of the caring role. We are encouraging people to do self-assessment, and we're developing a range of online forms for people to go online and complete their own assessment. We've provided our social care staff with mobile devices so that they can do assessments with the service user, and this means that our social care staff can spend more time with service users completing the form rather than back at the office doing the administrative tasks. We have phone-based assessments. We're also piloting social care clinics where people can book an appointment with a social care worker and have their assessment at a local clinic. We will always have the option of people being able to have a face-to-face visit in their own home where people can't get to clinics, or where people would benefit from that one-to-one dialogue with a social care worker in their own home. The assessment is trying to look at what do people want to achieve and what goals do they have. And finally, the assessment would look at making an eligibility decision.
The Care and Support Regulations 2014 Eligibility Criteria are now set in law. Here is some information on the regulations put in place. An adult's needs meet the eligibility criteria if the adult's needs arise from or are related to a physical or mental impairment or illness. As a consequence of the following, there is or is likely to be a significant impact on the adult's well-being. They are unable to achieve two or more of these outcomes: managing and maintaining nutrition, maintaining personal hygiene, managing toilet needs, being appropriately clothed, being able to make use of the adult's home safely, maintaining a habitable home environment, developing and maintaining family or other personal relationships, accessing and engaging in work, training, education or volunteering, making use of necessary facilities or services in the local community, including public transport and recreational facilities or services, carrying out any caring responsibilities the adult has for a child. We need to consider the adult's level of need accurately, as circumstances change and needs fluctuate as to whether the adult meets the eligibility criteria.
For people who are eligible, the assessment will give a budget allocation, and this is the amount of money that we're using to plan in the support plan about how best to meet their needs. There's different ways that people can take a personal budget allocation. There is managed budget allocations, which is where the local authority will plan and arrange those services, or people can choose to take a direct payment, and this is cash directly to the service user to have the freedom to arrange their own services, or people can choose to take a blend of those two. What's important, irrespective of what option you choose, is that we get good value for money for our services. Once the support is arranged and in place, we will arrange a follow-up review, and the purpose of that is to check that the person's support is meeting their outcomes, that the services that are being provided are good quality, and to see whether the support that's in place can decrease or needs to increase depending on how things may have changed. Hopefully, people will have regained their independence and will no longer need the support of the council.